Hey, this is Doug Field, CEO of the Institute, along with Brent May, Steve Managing Director, and welcome back to this segment, Healthcare Consumerism Radio. And joining us to talk about the growing concerns over medical costs and access and where technology and telehealth is evolving to kind of serve the needs of the consumer and both the employers out there is Adam Jackson, CEO of Doctor on Demand. Adam, good morning.
Hey, good morning. Thanks for having me.
Yeah, we appreciate you taking time out of your busy day to join us. Give the audience a little background on Doctor on Demand.
Sure. So Doctor on Demand is a national healthcare service that provides video visits with board-certified doctors on a patient's smartphone, tablet, or desktop computer. So you just download our app, create an account, check if your employer is covering the costs or not, and within a couple minutes you are having a face-to-face video visit with one of our doctors.
How do you see this space growing right now?
You know, it's I think we're kind of in a golden age here for telemedicine. I think with the combination of the Affordable Care Act, bringing a lot more people onto the rolls, along with technology, in particular video technology being a lot more ubiquitous. So now, you know, more things can be clinically effectively treated virtually. I think with all those things coming together, this is the time for telemedicine to really take off and become mainstream.
Yeah, and it's just not about cost, is it, Adam? I mean, it's really about accessibility, and in many ways it's about people accessing care when they may have not have through the traditional means, correct?
Yeah, totally agree. I think, you know, technology like ours is helping people get treated sooner when they may have gone untreated. It's certainly increasing productivity. You know, we have data that shows with our employer clients, you know, sick days are reduced. People aren't having to take time off work, pack up the kids, and go into the doctor's office and wait for a few hours, let alone the wait time to get an appointment. So it really is, as you said, solving the access problem.
What's the most confusing factor out there? If I'm an employer looking at the solution sets for my employee population, what's the most confusing factor out there? Because there's a lot of different models out there, a lot of different choices.
You know, there's a couple of factors in there, and I think one of the things that confuses and possibly scares people who are making the decisions at the employer level is the equation where you have to factor the per employee per month fee plus the utilization fee, and what kind of ROI is that really driving for us? When we designed our business and how it would integrate into benefit plans, we said, look, let's just make this simple. We're going to throw out the PEPM fee, only charge the employer when the service is utilized, and let the employer designate the copay, even by department. So some people can pay a $10 copay, some people can pay a $0 copay. Our visits are $40, by the way. You know, and then let us show you the real data about, you know, where would that person have gone otherwise. You know, we can analyze the claims data. So now if you have the PEPM in the equation, it gets complicated. It's, okay, well, if I'm paying $1 per employee per month, I've got all these employees, but we only had this many use it. What's the actual cost per visit? Right. And with some of our competitors, that number can be $150, $175, $200 per visit after you factor in PEPM. Well, for $200, we should send a doctor to your house.
Yeah, I was going to say that kind of takes you out of the price benefit, doesn't it?
Exactly.
How long have you been working with employers? When did you actually launch directly through employers to employees?
So we came out the market in direct to consumer about a year ago, and then very quickly thereafter started working with employers. There was a ton of inbound interest. We knew when we started the company that we would eventually get there, but because of a lot of the inbound requests we had, we ended up getting there sooner. So we started working with employers back in I would say January, February this year.
Okay. Now, Adam, this is Brent. Do you embrace brokers and their role in the market and taking your solution into the employer and client as well? Is that a channel for you?
Absolutely. Yeah, we've got great relationships with a lot of the big benefits consultants, all the way down to the smaller brokers, sort of on the regional level. You know, we make things really simple for them as well. We like to arm them with, you know, for us, we're a huge cost saver, you know, so a broker can bring us in and say, you know, forget the PEPM. These guys only charge when you use it. You can pass the full 40 through to your employees, or cover a piece of it, half of it, or whatever. And you sign one contract, and we do all the hard work of working with benefits people and sending collateral, doing on-site demonstrations. We love the broker channel.
Now, when Adam, a lot of the plan designs that you see out there, that brokers are helping their employers put in place, or the others are helping. The plan designs are moving more towards higher deductibles, and your solution marries quite well with a high deductible type plan, correct?
It does. When you got to spend when the first $2,000 or $3,000 or $4,000 a year is coming out of your own pocket. I mean, that's the type of insurance my wife and I have. $40 for an urgent care style visit is a no-brainer over a $100 office visit or a $200 urgent care visit.
Yeah, Adam, where do you see, on the last two segments, I don't know whether you had a chance to join in, but, we active discussion around exchanges and the fast growing emergence of particularly private exchanges. And you would seem to fit very well as a partner with these various private exchanges. Are you in conversations with them right now?
Yeah, I was listening to the earlier part of the show. Very interesting stuff. We are in a couple of early conversations. Not a ton I can speak to there yet, but again, it makes perfect sense in that setting. We're increasing access, and we're significantly reducing costs there. So that's something we're looking very much forward to jumping into.
Yeah. So Adam, so your big differentiator is your business model, but really the video technology component too, because a lot of them are still using traditional telehealth, correct?
That's right. Yeah, our core two differentiators are, and look, I'm an internet geek, a product guy, so I'll always harp on. We've got the better user experience, which we do. That's not always the most important thing to all the decision makers. But so it's one, we work on just about anything with the camera, and we're video first, meaning, as you pointed out, we don't support just the plain old telephone call, and that's because we talked to the state medical boards when we were designing the service, and they all made it clear, and you see the FSMB guidelines that have been adopted recently by 25 or so states that say very clearly, you aren't practicing medicine if you can't see the patient, and seeing the patient means in person or over live video. Mm-hmm. So we designed it from the ground up to be video first. We support any device. You don't have to have the new $500 iPhone. You can have a 6-year-old Dell computer with a webcam bolted to the top, and that works for us as well. And then the second huge differentiator, like I've said, is the no PEPM.
Now, Adam, do you, as far as channels, another channel would a health plan be attracted to your solution and embedding it for their member population?
Absolutely. We've already signed on a few health plans, and we're in very active conversations with a lot of the larger ones as well. For the exact same reason, Comcast signed on with us. It's a direct cost saver. We can steer these expensive visits out and get them to be done virtually. Huge saver for the plan.
Now when you look at this and the video piece specifically, what are you able to treat? What is the extent of the visit? Is it more for a sore throat, common cold, or does it go beyond that to other factors?
Yeah, so today it's something like 17 out of 20 things you would present at an urgent care with, we could do over video. Okay. So obviously we're not giving you a flu shot. We can't, the iPhone can't reset your broken bone. Maybe next year's iPhone. Okay. Not yet. And we can't stitch you up. But short of that, we can do a lot of stuff for you. To be clear, it's short-term, non-emergency medical things. So we're not into chronic care management at this point. We probably will be in the future, but today's practice strictly sort of urgent care style cases. Our medical director team has actually written 220 video medical protocols. So these are, how would you treat a sore throat or pink eye or things like that in person, and then the little twist you would do to do it effectively over video. So all our physicians are trained with those video protocols and can very effectively treat that way.
Now, when you look at the providers, how are they embracing this type of solution?
So we're kind of the first work from home option a doctor's ever had.
So they can do this in their pajamas, huh?
They can, as long as they got a white lab coat over the top.
That's right.
We're happy. We like to control the visual experience. As you guys can imagine, this isn't a mainstream form of care yet. So,
right.
A lot of people that are using our service, A, it's the first time they've ever video chatted a doctor, and B, it's the first time a lot of them have ever video chatted anybody. Yeah. So, it can be a little bit of a new experience, and we need to make sure, one, the technology is reliable, gets out of the way, and two, the doctors are, in a setting where they're making the patient feel comfortable. And so what we do, the doctors, they can work from home, they can work from their office, they can work from their vacation home. It doesn't matter to us. As long as you have good internet, you're on a computer with we actually send little clip-on LED lights so your face is well lit. We actually do send you the white lab coat with the Doctor on Demand logo. And they're trained through our program to kind of maintain eye contact with the camera and provide a reassuring and comforting experience to the patient.
Hey, Adam, we've really enjoyed having you on the program. We got about 30 seconds to go, and can you give our audience kind of a wrap-up and how they can find you, please?
Absolutely. So you can use us on the web, drondemand.com, or search the App Store. We're on Google Play for Android and as well as iOS. Just search Doctor on Demand in the App Store, and you'll find us.
All right, Adam. Hey, we really appreciate you joining us on the program today. If you can, we'd love to have you join us at IHC Forum West out in Nevada. It's November 10th through 12th. If you can make it, we'd love to have you. And to the rest of our audience, again, today's the last day to sign up for the early bird rates, so make sure you do that if you haven't already done that. Adam, have a great weekend. And to everyone else, we will talk to you next Friday on Healthcare Consumerism Radio.
Thanks, guys.